am really excited to present someone for you today. Dr. Ken Langa is the A. Regula Herzog Distinguished University Professor of Internal Medicine and Survey Research. He's also the Cyrus Sturgis Professor in the Department of Internal Medicine and the Institute for Social Research at the University of Michigan. This is a really long bio. He had to shorten it for us. He has a lot of awards. He's co-principal investigator and co-director of the Health and Retirement Study, co-director of the Harmonized Cognitive Assessment Protocol, International Network, both funded by the U.S. National Institute on Aging. Dr. Langa received an MD and PhD in public policy at the University of Chicago as a fellow in the Pew Program for Medicine, Arts, and Social Sciences. He's a general internist and an elected member of the U.S. National Academy of Medicine. Dr. Langa's research focuses on the epidemiology and economics of Alzheimer's disease and related dementias. Dr. Langa will talk with us today about risk factors for cognitive decline in dementia and what recent research has shown regarding ways to decrease your, mine, and our risks for dementia and stay cognitively and physically healthy as we age. So please help me welcome Dr. Ken Langa.
Great. All right, thanks. Everyone hear me okay right here? Thank you, Sue. Thanks to the association for inviting me to give this talk, and thanks for coming out in the snowy weather. I'll dive right in here, and I'm going to leave some time for questions at the end, but certainly if I'm not clear about something and you really want to raise your hand and ask a question along the way, feel free to do that. And again, hopefully we'll have some interesting and actionable information for you about trying to stay healthy, keep our brains and bodies healthy as we age. Just as a quick overview of what I'll hope to do in the next 45 minutes or so, 40 minutes. First, just give a little background and define some things like what is dementia and what is Alzheimer's disease. And then, again, talk about what research has shown over the last 25 years or so, some of which we've done here at Michigan and other places, about reducing your risk of dementia. And there's the punchline right there. Walk, talk, and read. That's what I've been telling my patients for about 20 years. Walk, meaning stay physically active. Doesn't have to be walking. Other activities is good too. I know at least one regular swimmer in the audience who swims with my wife all the time. So swimming's great. Also, talk, staying connected with people and organizations, sort of doing, I'm preaching to the choir here, doing what you're doing here by staying connected and active, and then reading. Lots of evidence that challenging your brain right from the time you're born, actually right into your 90s is extremely important and helpful for keeping your brain healthy. Again, I'll talk about some of the work just as a plug to good old Wolverine research here at the University of Michigan, some of the work that we've done, and then finish up. All right, so first, what exactly is dementia? This is kind of the basic criteria from a very common diagnostic criteria that has been used since 2011. So what dementia is defined as is impairment in at least two cognitive domains, sort of thinking, things that our brains do to get us through the day. So obviously memory is probably the most commonly thought of when you think of Alzheimer's disease and dementia and decline as we age, but also reasoning, sort of being able to plan and follow a recipe, things like that, visual spatial abilities, being able to just sort of make sense of our physical surroundings, not getting lost, speech, and then behavior. So again, to be diagnosed with dementia, at least two of those domains need to be impaired. And importantly, for the definition of dementia, those impairments have to be severe enough to, you can see the sort of official text on the screen there, interfere with the ability to function at work or usual activities. So basically the cognitive decline has become severe enough that one needs help during the day. You've hit the disability threshold, as it's called, and are no longer able to really stay independent. And then also just those impairments in function, in thinking and function, are not explained by some other psychiatric or acute problem. Here's sort of just a general, hope you can see that, a general schematic of sort of brain aging or and function as we live, just to have some of the terms. You can see the green line there, normal brain aging. You can see even for normal aging, it's going down, right? Most of us, we were talking before, everyone sort of starts to have some troubles thinking, forgetting names, forgetting faces, where'd I put my keys, things like that. There is some decline that's normal. Everyone will have some of that. The sort of non-normal or more concerning trajectories are kind of the orange and red there, that at some point that trajectory is more steeply downward, and it's not just that you're forgetting your keys, but maybe what are keys used for as you're declining on your cognitive function there. And MCI is a term you may have heard before, mild cognitive impairment. That's a sort of classification of having some of those cognitive problems. You're sort of measurably worse than you used to be, but you haven't hit that threshold of dementia where you're disabled. So you might have a bit more trouble. For instance, I talked about a recipe, might take you a bit longer, but you're kind of still able to do it and still sort of safe in your home. It's possible that you can sort of flatten out from there and not keep going in a downward trajectory. I'll talk about some of the reasons that might happen, where you get to MCI and you just sort of stay that way. But then mild dementia, moderate dementia again, when those impairments continue to worsen and you become disabled in daily life. So what are some of the causes of dementia? So Alzheimer's disease, again, is one type of dementia, which again is a very common question and unclear exactly what the relationship between those two are. But dementia, again, is the more general syndrome, as it's called in medical terminology, and Alzheimer's disease is one of the causes of that syndrome. You may know Alzheimer's disease characterized by the buildup of abnormal proteins in your brain, one called amyloid, the other called tau. I'll talk again a little bit more about that in just a bit. Vascular dementia, as the name implies, is related to troubles with blood flow to the brain, so getting atherosclerosis, the buildup of cholesterol plaques in your arteries that makes it harder to get the blood to the brain. That's what vascular dementia is. And then you can see some other rarer causes. Parkinson's disease increases your risks for dementia, something called frontotemporal dementia, dementia with Lewy bodies. Late is is short for that long, complicated medical words there that you can see: limbic predominant age-related TDP 43 encephalopathy. TDP is another abnormal protein, different from the one that causes Alzheimer's disease. And then some reversible causes, which are important to, if you or a loved one is having some cognitive decline that you're worried about. Things like, again, I'm sure you've all seen this, even with yourselves or others, being on lots of different kinds of medications can sometimes have the unintended effect of making cognitive troubles or cognitive impairment, alcohol, B12, depression, and other things there. But just to make things a little more complicated, it's actually the case that for the types of dementia that we think about as people get older in their 70s, 80s, 90s, it's almost always the case that there's more than one problem or pathology going on, that Alzheimer's disease overlapping with vascular problems. So this makes it a little more complex to think about treatments and preventions, because it's again, the brain's a complicated organ, obviously, and the things that can cause it to malfunction are also complicated. There's different pathologies, and almost always these pathologies are overlapping and mixed. So to dive in a little bit more about Alzheimer's disease, and more specific about the abnormal proteins, is just sort of a cartoon here showing the spindly things are your neurons, the nerve cells in your brain. You have about 100 billion nerve cells, neurons in your brain, and 100 trillion connections between them. So the sort of long strands coming out from the centers of the cells there are connecting with one another. Those are, again, the connection between brain cells are called synapses. Those are the things that somehow fire in ways that allow us to think and cause consciousness in ways that we still don't really understand at all. The kind of fuzzy looking stuff below that cell on the left there is the abnormal protein called amyloid that builds up outside of brain cells. The kind of dark stuff within the cells is the other abnormal protein called tau. And those abnormal proteins, again, build up for reasons we're not entirely sure right now. They can cause an inflammatory response, that your body will sort of react to those proteins and send white blood cells and inflammation and cause death to the brain cells, and that's what ends up causing the problems with your cognition. Here's a picture just to get a better sense, a larger sense of how that can affect your brain. That's sort of on the left side of the slide is a kind of picture of a healthy brain. On the right, one with advanced Alzheimer's, and obviously the most obvious difference is just sort of the shrinkage that's caused by Alzheimer's disease. That's, again, this inflammation leading to death of brain cells and a shrinking of the brain. This one particular area down there on the bottom, we should pay attention to. I'll talk more about that going forward. That's called the hippocampus, which is a part of the brain that where sort of memory formation, maps of the outside world, that's the part of the brain that's required to kind of lay down memories initially. So on the other side, in the Alzheimer's affected brain, you can see that there's a kind of big space where much of the hippocampus is, and that's again sort of the classic change of Alzheimer's disease is shrinking of this hippocampus, and that's what again leads to the memory problems that are typical of Alzheimer's disease. Just to cover some things you may have heard in the news over the last year or two, it is a sort of very interesting and exciting time in Alzheimer's disease research. I've been doing this for 25 years or so, and up until a couple years ago, there's been almost no successful treatments or new treatments for Alzheimer's disease. But over the last couple years, there's been two important changes. One is the development of blood tests that allow the identification of that amyloid and tau protein in the body. So by just doing a blood test and looking at levels of amyloid and protein in the blood, it can actually give you a measure of how much amyloid and tau is in your brain. So that's obviously a big potentially big development in terms of trying to diagnose Alzheimer's disease. There's also been, in the last few years, 2 new treatments that actually remove that amyloid from the brain. Again, I've heard of these. Leqembi and Kisunla are the trade names. of these new medicines. They've been approved over the last couple of years for MCI, that mild cognitive impairment, and early Alzheimer's stage. Some of the problems with these, or problems with the medications that are now available, they're quite time consuming. They're not pills. You have to go to an infusion center to actually get these intravenous infusions every 2 to 4 weeks, which obviously is not an ideal way to have to get a medication. There's also, I won't go into it today, it's sort of a topic for another couple hours of talking and discussion about the benefits of these medications. Are they truly sort of changing the trajectory of cognitive decline? Are they keeping people thinking better longer? Are they worth both this, the potential side effects? There's potential significant side effects with these medications, including small amounts of bleeding in the brain as it affects blood vessels. They're very expensive. You have to have an IV infusion. So interesting, again, debate about these medications, which will continue over the next decade, I'm sure, as new versions of these and perhaps pill forms of these medications become available. All right, so turning to kind of the main focus of the talk, how exactly can we try to prevent this cognitive decline and dementia in middle age and later in life? What can we do? And again, it is, in the time that I've been working on this, actually quite optimistic news in the last quarter century or so. And that the optimism is about that it does seem clear that we can do things, change our behaviors in ways that can have an important impact on the risk for dementia. Again, some estimates are that up to a half of the cases of dementia around the world right now can be prevented by addressing several things. And this is sort of split up into kind of early life, midlife, and late life. What are the things that we can do? Schooling, again, as I'll talk about even more, and I mentioned already, it seems very clear that how we use our brains as they're getting wired up, again, from birth basically through our mid-20s, how you, again, challenge your brain. Are you thinking about complex things? Are you in conversations that use all parts of your brain? There's sort of the clear analogy to working out and keeping your muscles or building up your muscles in the same way that by using our brains, those connections between those neurons seem to get strengthened in important ways. So again, kind of lots of research showing that the more you go to school, going through college, and the number of years you spend in school is related to how your risk of dementia later in life, with more schooling decreasing that risk. And then in midlife, again, lots of epidemiologic and other research over the last 25 years or so show that these cardiovascular risk factors, think again about that the overlap of Alzheimer's disease and vascular disease, anything we can do that decreases atherosclerosis, keeps our blood vessels healthy, seems to also decrease our risk for dementia. So again, blood pressure, smoking, trying to stay a healthy weight, and again, physical activity to address all of those seems really important. Other things like not drinking too much alcohol, staying away from injuries to your head, mental health issues, things like trying to get treatment for depression and anxiety also seems important. And then addressing hearing loss, also more recent evidence suggests that using hearing aids is also important for decreasing dementia risk. And I'll, again, talk a little bit more about why that might be in just a bit. Later in life, again, this idea of staying connected to other people and activities seems important. Social isolation seems to increase the risk of dementia. Another sensory impairment, visual loss, also seems to increase risk. Both the hearing loss and the vision loss probably have impacts in a couple ways. One is to people who are having hearing impairment or trouble with vision are less likely to go out into the world and interact with people, just because it becomes more difficult, whether through embarrassment or just safety, again, sort of not being able to see where you're going or hear. So that sort of connection to social isolation and staying connected, probably one of the pathways that sensory loss, like hearing loss and vision loss, acts. But also perhaps just the stimulation of the brain itself. Again, back to the idea that keeping our brain exercised or engaged seems important for keeping it healthy. If you're having less visual signals and hearing or auditory signals going to your brain might actually damage the brain itself. Air pollution, and another growing evidence that the environment around us, the world around us, also has important impacts on the brain, including a negative impact from air pollution. I'll show you a little of research about that in just a minute. All right, so to kind of dig in a little deeper on some of these key issues that seem to allow prevention of dementia. Again, physical activity is, if there's one thing I'd take away from the talk today, is how important it is to be up and moving in any way, even 15 minutes a day, 30 minutes. It just seems like our bodies evolved in a way that, as people have done less physical activity or been required to do less physical activity, that has lots of negative effects on the brain. I often call it the only silver bullet in medicine. There's no bad side effects to getting up and walking, other than being careful and not falling when you're out and about, which is important. But there really is no downside to getting up and moving. Just a couple of sort of research studies that have been done relatively recently to show this relationship. This is a famous study you may have heard of. The Framingham Heart Study has been going on since the 1940s. The town of Framingham, outside of Boston, some epidemiologists basically enrolled everyone in the town in a study back in the 40s, and has been following many of them ever since. Lots of the research on why cholesterol is bad for us and treating cholesterol all came out of the Framingham study. So they've also, again, been looking at risk for dementia. This is kind of a geeky academic figure here, but just to work through it with you. This is, again, from that Framingham study. They looked at the sort of 3 different phases of life. You can see early adult life, midlife, late life, these groups along the left side here. That was people younger than 45, and then the midlife was 45 to 64, and then later life 65 and older. And they split out those people by how much exercise they did, basically how much physical activity that they reported. And 5 is the highest level within each of these groups, and 1 is the lowest level. And then the sort of figure on the right side is kind of the punchline here, where the kind of dotted line down the middle means is kind of the null point where it's compared to. So they're comparing to the people who did the lowest level of activity. And then to the left of that line basically says that group has a lower risk of dementia compared to the reference group, which again is the group that did the least amount of exercise. So you can see, mainly in kind of looking at the midlife and late life groups, as you do more exercise during life, your dementia risk decreases pretty significantly, down to almost half. For the late life, the folks that did the most exercise had almost half the risk of dementia compared to those that were doing the least. Interestingly, in early adult life, you can see there's not as much evidence of a benefit of physical activity. So it does seem like kind of midlife and late life, staying active during that time seems especially important. Just another type of study. This is a more experimental study where a group of adults was randomized to an exercise program where people were sort of encouraged to walk and be active up to 40 minutes a few times a week, compared to others that were just doing a stretching exercises, not really getting out and walking. The top row is looking again at that important area. We talked about the hippocampus, and basically the hippocampus grew in the group that was doing physical activity. That's the top line there. You can see sort of going up as they did MRIs over the next year. The volume, the size of that hippocampus actually got larger in the group that was doing physical activity compared to the other group that wasn't. Other parts of the brain didn't really get as much benefit or any benefit from the physical activity, but again, that hippocampus where the memories are formed, it does seem very sensitive to physical activity. One other quick study that I was involved in, this is from a large study in England and the United Kingdom that has collected lots of information and on dementia risk and genetic risk and other things, lifestyle, throughout the life course. And again, a similar kind of figure over there on the right, showing dementia risk. And the key take home from this study was, what we were looking at was, there are genetic risks for dementia, for Alzheimer's disease. So it is the case that Alzheimer's disease, for instance, runs in families. If your parents had Alzheimer's disease, you are at a bit higher risk. It's definitely not determinative that you'll definitely get it, but there are some genetic risks. But what we did here was to try to look at, even if you're at high genetic risk, which is that lower group there, the lower three rows, having better lifestyle. This was favorable lifestyle, intermediate, unfavorable, based on a few different things, whether you smoked or not, how much physical activity you did, and how much alcohol you took. So some of those lifestyle issues that we talked about before. And basically, no matter what your genetic risk was, if you had a favorable lifestyle, your risk of dementia was lower overall. So again, even if you're at higher risk, it still pays to do these lifestyle changes. And here, I've always liked this little cartoon here. So what fits your busy schedule better? Exercising or being dead? So I think that's a good way to encapsulate everything I said for the last 15 minutes. Although some of my patients will then think about this. There's no improvement, Henry. Are you sure you've given up everything that you enjoy? So there is some balance. You still, if you don't want to live longer if you're hating every day that you're living, right? You still want to have some enjoyment in your life, but trying to figure out that balance of getting up off the couch, eating a little bit better is important. All right, let's turn to education and what we're doing in this room here and lifelong learning. Again, I talked about this. Education seems incredibly important as you're growing up. The sort of academic jargon for this or these terms is called cognitive reserve, that, again, somehow challenging your brain builds a stronger brain. And on this graph here, it's sort of age, as getting older, going to the right, and how your brain and cognitive function is working. People who have that high cognitive reserve, who've done education, challenge their brains for years and years. Again, it seems like there's stronger connections, more connections. So as you get some of those proteins, which almost all of us do, the bad proteins, your brain is able to deal with them and sort of adjust to them better. So your brain keeps functioning normally farther out and older than someone who has that low cognitive reserve. And if you do start declining, it's usually later, and you're more likely to not hit the dementia threshold because you die of something else earlier, or you do it at a later time. So that's sort of the idea of cognitive reserve. So there's a kind of fun set of studies that address this idea of lifelong learning, not just when you're growing up and a kid, but even into your adult life, that challenging your brains. So before Google Maps, so 20 years or so ago, London taxi drivers would spend up to 4 years learning the map, the complicated map of London and the city and how to navigate it. And again, back to that hippocampus is the area in the brain which stores these maps of the outside world and allows us to think about geography and think about three-dimensional space. So some researchers in England had this question: what happens to the hippocampus of those London taxi drivers while they're learning the knowledge, is the slang for this 4 years of learning the map, learning the knowledge. And again, not surprisingly, what in the theme of what we've talked about so far, the folks that qualified, the taxi drivers that passed their test after the 4 years of knowledge, have larger hippocampus than those that didn't, and then also those sort of control groups that weren't doing this. So again, the punchline being this challenging the brain, learning a map actually seems to physically change the brain and increase the size of the hippocampus. It's just another way to see it, that the longer they sort of followed taxi drivers for years afterwards, and the longer they were at it as a taxi driver and challenging their brain with these with the maps and navigation, the larger the hippocampus overall. Other things, and again, I'm sure you've heard some of these studies reported in the news and in newspapers. Really, almost all cognitively stimulating activities, many have been studied, things like, again, reading, board games, crossword puzzles, musical instruments, I was talking about before, seem, sort of learning new musical instruments and challenging your brain that way, dancing. There's been studies that suggest that all of those things, again, sort of keep your brain healthy, decrease your risk of dementia. There is one, again, back to some of the academic stuff we worry about in doing all of this research, especially research that's not an experiment where we're just sort of following people over time. There is this issue, what we call reverse causality. So again, I said that, the longer the taxi driver was driving, the larger their hippocampus was. There is this, it could be going the other way, that as people become a bit impaired, they stop doing those activities, and it sort of shows up in our studies as the activity is keeping you healthy, but it's actually going the other way, that when people start to become unhealthy, they stop the activity. So that's always something we need to think about in these studies, and frankly why you hear about this dietary change may help you long term or may help your health, and then you hear 2 years later, no, that's not actually how it works, and you kind of change, and many of those sort of changed results are related to these ideas of either confounding, where what you're looking at is it's not really that intervention. It's not driving a taxi that's leading to healthier brains long term. It's that healthier brains allow you to become a taxi driver and things like that. So again, just as a quick cautionary tale that science is always updating, and we have to kind of not put all of our eggs in one basket, so to speak, on some of these issues. Let's just talk briefly about social isolation. Again, I've talked about it a bit. Loneliness, being socially isolated, also increasing evidence that that has a negative effect on your health in general and your brain in particular. This is from a specific study of University of Michigan study that I'll tell you a bit more about, where some colleagues at the School of Public Health here looked at people reporting loneliness. So this is from, again, a study, large study based at the Institute for Social Research at the University of Michigan that I've been working on for 25 years or so with some great colleagues. And in this study, the specific study about loneliness and risk of memory decline, colleagues looked at, we asked a question, we asked people to tell us have they felt lonely over the last year or so, and we interview them every 2 years. And the people who told us that they felt lonely had an increased risk for memory decline over this time period. We also test people's memories in this health and retirement study. And the more time points that people told us they were lonely, the increased or the greater the risk of memory decline we found. So someone who told us that they were lonely at only one time point over 8 years, their memory it was as though they had aged about 3 more months than the people who hadn't reported being lonely. And if you had told us that you were lonely at 3 different time points during those 8 years, it was actually as though the amount of decline, memory decline, compared to someone who wasn't reporting loneliness was actually as though you had aged an additional 2.5 years. So again, it does seem like there's a negative impact of not having stimulation through conversation, through just comfort with having people around you. So just, again, as a quick aside, I've been talking about, it seems clear that we have the power, we can change our behavior, our lifestyles, and decrease our risk for cognitive decline or other bad things later in life. It is the case, and I don't think all of you know this, but just to say it specifically, again, the environment and sort of the social conditions that we find ourselves are also have huge impacts on life expectancy, on health. Again, from this health and retirement study, we've found that, for instance, rich women live to age 89, poor women to 79. So there's a huge impact on life expectancy and health just on the where you are in the economic order within the United States and in places around the world. Again, as many of you know, there's also very different racial and ethnic differences in the United States and other places. For instance, African Americans have probably twice the risk of dementia compared to white Americans, even though their life expectancy is shorter. And these disparities have gotten significantly worse, have widened as part of the COVID pandemic and sort of the varying impact of the pandemic on people who were rich or poor, white or black. So again, just like to make sure that we keep that in there, that it's not it's not just your own behavior, it's sort of where you find yourself in society that also has a huge impact on health. All right, just to finish up, a plug to some of the University of Michigan research on dementia with some results I think will be of interest to you. So this is, again, from this health and retirement study that I mentioned. We published a paper in 2014. My colleague Michael Hurd, who's at the RAND Corporation, led this study to try to understand the full economic impact of dementia in the United States using data from that health and retirement study. And the, again, sort of the bottom line, punchline is that it's an incredibly expensive disease. About $50,000 per case per year was the general big picture cost of one case of Alzheimer's disease. This is or dementia, I should say, the additional economic impact per person in the United States. This was in 2010. And again, for many of you who have had to take care of people with dementia in your families, not surprising that fully half the cost of dementia is just accounted for with the time that families have to spend providing care. Another quarter of that is long-term care and nursing homes. So again, nothing that's too surprising, but to see the full impact, the $200 billion a year to the United States, 50,000 per case, and the huge impact on the families, we think is important to recognize for ourselves and for policymakers. This was actually, again, some good news related to dementia risk in the United States, and this has been shown in other countries around the world. That bar on the left, about 11.6% of people in the United States who are 65 and older had dementia in 2000, the year 2000. That had actually declined. The rate of dementia declined for the 65 plus population. So that might sound surprising, but again, it has been shown in other places around the world. And the main reason for this is the big increase, we think, is the big increase in level of education during that time period. So sort of post-World War II, the number of people going to college kind of shot up in the United States, and there was just a large increase during this time period of how much education people have. And we think, again, back to that idea of cognitive reserve, that explains this actually decreased risk. So again, just to say it plainly, an 80-year-old today has a significantly lower risk of having dementia than an 80-year-old in, say, 1990. There's more people with dementia and Alzheimer's disease now than 30 years ago, but that's because there's been a huge increase in the number of people that are older. But for each individual, the risk seems to have gone down. Again, we think partly for this increase in education, probably also better treatment of some of those cardiovascular risk factors that we mentioned. This was a study just to kind of show that the racial difference and the racial disparity that I mentioned, and what this graph is showing, again from the Health and Retirement Study, is the relative rates of dementia for African Americans versus whites in the United States. It's between 2000 and 2016. And just focusing on the left panel there, basically the risk for dementia in African Americans is almost 2 times, sort of 1.8, 1.5, and 2. That's the ratio between blacks and whites. And that sort of difference, that disparity, came down slightly, but not too much, between 2000 and 2016. Still, African Americans had 1.5 times the risk of having dementia in the United States compared to whites in 2016. Then showing, again, focusing in a bit on this interesting issue of air pollution and the impact that air pollution might be having on our brains and our bodies. This, again, is from the Health and Retirement Study, where we linked in, there's now databases that have information on the level of pollution in various places across the country. And by linking that with this, where we know people live in the Health and Retirement Study, we can do these studies of what's the relationship between how much pollution you've been exposed to and your dementia risk. And we did find, and again, this has been replicated in other places around the world, that people who lived in areas where they were exposed to more pollution during their life, especially pollution from wildfires and agricultural runoff, pesticides, things like that, those areas seem to be related to the biggest increase in dementia risk for people who are exposed to those. The Health and Retirement Study that I mentioned, it's been incredibly fun to work with, again, great colleagues at ISR. It's also been fun because many countries, or a significant number of countries around the world, have started studies patterned on the HRS. You can see about 40 countries around the world now doing studies patterned on our study here in the United States. And also a number of studies, the HCAP studies, are specifically focused on the issues of cognition and dementia. And again, it's not only do you learn important information about the health of people in other countries around the world, but to have studies done in similar ways where you can compare outcomes and what's the risk of dementia in parts of Africa versus the United States versus Brazil versus Europe allows you to try to understand a bit better what are the things that could decrease or increase risk around the world. Was there a question?
We can't read it, I guess.
Oh, it's actually not that important. It's the various. Yeah, I'm sorry about that. This HRS, the Health and Retirement Study, is the studies that I've been mentioning. That's sort of the green and white. The green and yellow are those studies. The others include these dementia sub-studies that I mentioned.
Because I was going to ask a question about whether the international studies related to culture and ethnicity, like multifamilies living together, or people who walk everywhere,
Yep,
or
absolutely.
eat Mediterranean diet, if that made a difference.
Yep, you hit the nail on the head. That's the whole idea of doing these kinds of investments and studies around the world is, there's different ways of families, multiple generations living in the same home, and those kind of cultural differences, dietary differences, public policy differences, things like countries that pay for long-term care and nursing homes. Does that lead to less burden on the family in terms of care? So all of those things are what we're trying to study. And actually, good lead in. Here's just to give you, again, you may not be able to read it. I can read it a little bit more. These are some of the kinds of studies from the international data that are trying to get at some of those issues that you mentioned. So for instance, the kinds of occupation that people have, the work that they do during their lives seems important for, again, preventing dementia risk, the type of how you use your brain in your job. So we've looked at that at a number of countries around the world. How education affects health and brain health in different countries around the world. The one at the bottom left is sort of interesting. This was a study looking at what's called a negative wealth shock. So if someone has some kind of tragedy in their life or loses money for various different kinds of reasons, whether it's divorce or a health problem or other things like that, that wealth shock, as it's called, seems to be important in your health long term, that having one of those wealth shocks can increase your risk of death, increase your risk of chronic disease, increase your risk of dementia. And then we looked at that in the United States, China, England, and Mexico to see how that might differ across those countries. And the wealth shock was had the biggest negative effect in the United States and China, actually. And again, still sort of people are following up on that to figure out exactly why. Again, perhaps related to public policies about in terms of addressing some of those wealth shocks or how housing might be affected or things like that. But that's sort of the idea of doing these kinds of studies in different countries. All right, so just to follow up and get back to the punchlines, to re-emphasize that, again, to reduce your risk of dementia and Alzheimer's disease, the various things you can do. The first one I mentioned in some ways before is die young. And most of my patients don't like this advice. But I do put it in there just as a reminder that we're really only here talking about dementia and Alzheimer's disease because of all the successes that we've had in other parts of medicine and public health. You may know life expectancy has increased 25 years or so over the last few generations. And so dementia and Alzheimer's disease were much less of an issue when life expectancy was in the 60s rather than around 80. So again, it's obviously a huge problem, but in some ways it's a problem that's related to the successes that we've had in increasing life expectancy long term. So obviously I don't want you to die young, but it is a way to you won't get dementia if you die in your 30s or 40s, and so life expectancy quite important in that sense. You can also, again, just to a reminder that our social conditions are important too, sort of what the kinds of environment that you're brought up in. Having educated, wealthy parents is likely to decrease your risk too. But then also the things we mentioned, the lifestyle things. Make sure to get up and move. That would be my one top advice to everyone. And I say to all my patients, it really does seem that physical activity, and again, it doesn't have to be running marathons every day. Even just getting up and moving a bit seems incredibly important for your brain. Talking, again, staying connected, doing the things that you're doing here, and staying connected with friends and family seems really important. Friends, families, and organizations. Again, this lifetime of learning, reading, challenging your brain, doing things that stretch yourself. We also learned one option would be to think about London cab driver. Although, as you may imagine, there's lots of interest now in what is Google Maps doing to our brains, that we no longer have to do any of that and just plug it in and it goes. Could be that we're doing damage to our hippocampus by not actually having to learn maps anymore. The cardiovascular risks are the other really important thing. Controlling blood pressure. Cholesterol, again, physical activity is good for all of these things. Didn't have time to go into it. Seems increasing evidence that trying to make sure you're getting enough sleep. Our brains actually probably clean out some of those bad proteins while we're sleeping, and that probably why getting enough sleep is important for keeping your brain healthy, sort of cleaning things out and decreasing the risk of that inflammation is what good sleep does. Vision and hearing impairment, again, making sure to use your hearing aids if you need them, get your cataracts fixed, use your glasses, keep the information flowing into the brain seems really important too. And that's it. Just thanks to our funders, or the National Institute on Aging, the Social Security Administration, all of the people that agreed to be in all these studies, we thank them. And I'll stop there and can take some questions.
All right, before we get on to the questions, just a reminder, online viewers, to send in your questions to umra@umis.edu, and we do have a couple. We'll start with those two, right? You said you had two?
Christopher asked about the connection between the B12 level.
Good question. So B12 and a number of other vitamins, B6 and some others, can have a direct impact on the health of brain cells. You sort of need B12 to keep your neurons healthy. So it's B12 deficiency is actually quite rare in Western countries like ours with the diets that we have. But it is that is one thing when someone's having some trouble with cognitive problems, you want to make sure it's not something that you could correct quickly, like B12 deficiency. So that's the connection between B12 and the brain and other nerves in your body.
Okay, we had another one from online. It's just the email address, Kanawak. Wanted to know the relationship between inflammation risk factors and increase in dementia risk.
Yeah, so as I mentioned, sleep, as we talked with just about at the end, but basically anything that increases the level of inflammation in your body. So as you all know, the inflammatory response in our immune system is what protects us against invaders like bacteria and viruses and things like that. Your white blood cells go to fight off those kinds of invaders, or if we cut ourselves, white blood cells and inflammatory, lots of different chemicals go there to rebuild the tissue and again address the things that are in our body, the bacteria and things that are getting in. The problem is that inflammation also can affect your healthy cells, or the things that you don't want to be fighting against. So levels of inflammation, for instance, in the brain, and these would be, sort of inflammatory cells within the bloodstream that are going to the brain, that are sort of interpreting the bad proteins in your brain as an invader in some way. The inflammation, sort of continued inflammation, will basically just damage the cells and the nerve cells and other cells in our body. For instance, arthritis, rheumatoid arthritis, or autoimmune diseases is another example of where the immune system ends up doing damage to the healthy cells in our body. So rheumatoid arthritis would be the cells, the cartilage in our joints, whereas again the inflammation in the brain will do damage to those brain cells and sort of cause that shrinkage of the brain because the cells are being killed off. And again, there's lots. One of the ways that physical activity is healthy or causes or does good things for us is to decrease the level of inflammation in your body. So sort of physical activity itself, sleep, kind of tones down the inflammatory response, and that's likely one of the important pathways that's keeping us healthy.
So I got a question, and I'm going to turn it over to him. You talked about these infusion things and so how expensive they are. Do you know whether or not Medicare or U of M's insurance policies cover any of that stuff?
That's a good question. Yeah, that's part of the debate. So Medicare, you may know that the typical process for drugs sort of going from research to testing to then out to be used, the FDA, the Federal Drug Administration in the United States, sort of has the job of examining the evidence for medications, and are they safe, and doing what they're doing in terms of improving health or improving cognition, or in the case of the Alzheimer's drugs. The FDA did their work and said that these medications do seem to have some benefit. Again, there's still some debate about how much benefit they're having, but then it's the CMS, the Medicare program, then decides, okay, the FDA says this is working, should we cover it as a insured medication? And CMS is now covering these infusion medications. There's some restrictions or criteria that you have to meet. As I mentioned, they've only been approved for MCI and the early stages of Alzheimer's disease. So you sort of need to do some testing to make sure that your patient, if you're a prescribing physician, your patient is within those, sort of fits those criteria for the medication before Medicare would pay for it.
Your presentation seemed to emphasize factors affecting risk or incidence as opposed to severity or severity over time. Does what you say apply in the severity or severity over time to essentially the same ways, or are there any differences or any lack of knowledge that we have in those two distinctions?
Yeah, that's a great question. I think there have been studies of, again, back to my beating a dead horse here, physical activity among those who are already have either MCI or dementia in the early stages, and that prevents progression to more severe stages. I do think probably at very severe stages of Alzheimer's disease or dementia that some of these interventions are likely not going to prevent more decline. But I do think, as you said, there's evidence of both preventing the initial onset of dementia, but then also slowing progression, and so preventing more severe stages for things like, again, physical activity, for instance.
Hold on.
Okay.
I'll let you decide.
It's over there.
I got Mike. Hi. As my hearing has gotten worse and I've gotten more sophisticated hearing aids that are Bluetooth activated, I've moved from reading books normally, if you will, to audiobooks. Has there been any? My wife says that doesn't count.
Yeah.
But and she's usually right. Yeah. But I thought I'd ask somebody who knows more than my wife.
Yeah.
So.
No, it's a great question. And I would say that the evidence is not in yet on that. I do think, so there is, again, this question of is the actual act of reading the words on a page doing something different to your brain than hearing them. I think, again, so the bottom line is I don't think we know for sure what is one better than the other. I think some of the theories are that, an audiobook, while it's doing something different, is still likely to, make for lack of a better term, make those neurons fire and, think about other things, just following along with the story itself. So my gut is, again, not backed up by research yet, that they probably have similar benefits, or at least some benefits doing the audiobooks. Again, assuming sort of the old-time reading that we think about maybe better than audiobooks. I'm pretty convinced that the audiobooks are doing something beneficial. It's better than not doing anything at all, would be my guess.
Okay, looks like we got 3 more questions we're going to try. I got 2 back here, and then we may go a little over, but we only got 3 questions.
Well, thank you. I just have 2 real quick questions. Do you have any opinion about commercially available supplements like Prevagen and others that are supposed to boost memory? And related to that, do you have any impression about commercially available computer-based cognitive stimulation kinds of activities?
Yep, great questions. I typically advise my patients that Prevagen and similar kinds of supplements, there's really not good evidence that they are beneficial. There's always the concern about people taking lots of supplements that it can be harmful as they interact and things like that.
Did
So I don't
another
think
email
there's
come in?
there's great evidence, or frankly any evidence at all for some of those supplements. Yeah, the sort of cognitive training and the online stuff is a really interesting and important question. Again, many of the there hasn't been a lot of evidence for some of the online games, but there has been a study of specific kinds of online training and cognitive training that do seem to have some benefit. I can send that information around if that would be helpful. But again, I think there's a range of outcomes from some of the online training. Much of it, I don't think there isn't evidence that it's going to prevent cognitive decline, but there are some things that, some specific kinds of things. One that sort of is very, what's the word, kind of attention-based. So you're sort of driving a car, along a path, and you have to note when certain things get in your way and things like that. So really sort of challenging different parts of your brain. And there is some evidence that those kinds of interventions, online interventions, might have benefit.
I have a question that may have 2 parts, actually. Recently, I was reading something, and they talked very emphatically about the role of electromagnetic waves that damage the brain, especially with extensive use by people, but especially by workers who are in that domain in their business. So that's one interesting aspect which I hadn't foreseen. The other is I would like your comment on the supplement that Sanjay Gupta has been talking about. I saw an announcement for a book that he has published last week, but I haven't yet seen it. So I'd like your comment on these matters.
Yeah. Supplement that Sanjay Gupta, I know that he's been doing work on aging, but unfortunately I don't know that one specifically. Sanjay.
Neuromax or something.
Yeah. Again, there may be some evidence of benefit. I guess and you can maybe get the sense from this presentation in general. I'm pessimistic or a little suspect about sort of one specific thing that might lead to benefit, like like eating blueberries or taking this specific thing, just because the brain is so complex and the pathologies are so complex. To me, that there's much more. It's much more likely that sort of these larger things like physical activity, staying connected, reading, are likely to do benefit. Again, I think the single supplement or the single type of food. To me, there's just lower likelihood that that's going to have a big impact. Again, I have to say I don't know the specific things that Sanjay Gupta was talking about. And then the electromagnetic waves or other kinds of environmental impacts. There's certainly possibilities that, again, for instance, we never thought of pollution or the chemicals in our environment that might have an impact. Again, I don't know the specific type of waves that you're talking about, but I would say in general there's a possibility that things in our environment will have an impact on the brain. But I don't know the specific type or evidence about those.
We got one final question. It's one from our online viewers. So here's our last question.
Daniel Burns says that you were going to add some comments about the tau protein.
About the tau protein, I guess. Well, I'm not sure exactly. They meant that. So that's what's known as hyperphosphorylated tau. Tau is a protein that's in all of our nerve cells and other cells that helps with sort of movement of nutrients around the cell. And what happens in Alzheimer's disease is that gets kind of misshapen, and these phosphorus groups get stuck on it and make it so it can't work. It's thought that the buildup of amyloid in our brains kind of increases the risk that the tau protein then becomes misshapen, and some of these medications are aimed at again decreasing the amyloid and therefore decreasing the abnormal tau protein. It does the tau. Some of the more recent evidence shows that that's likely the tighter link with cognitive decline than the amyloid protein that's outside the brain cells. I'm predicting you'll hear lots more about tau related to these medicines over the next, again, 5-10 years, because it does seem as though that's the thing that's showing up again and again as the key link between the pathology and cognitive decline. That tau seems very important. I hope that's what he had in mind.
Thank you very much for the talk. It's terrific. A lot of interest in it.
Thank you.
And thanks for staying a little bit extra. This topic was fascinating, and there's more questions. I don't know if you'll hang around,
Sure.
but
Happy to hang around.
I'll corner you over here.